Singapore's response to COVID-19 was not without its shortcomings, and the government could have done things differently. Prime Minister Lee Hsien Loong says that's despite the good health outcomes achieved so far. Geraldine Yap with more.
It's been almost 8 months since COVID-19 first reached Singapore shores, and Prime Minister Lee Hsien Loong says the country has done well so far in managing the pandemic.
Our fatality rate and absolute numbers is one of the lowest in the world. New infections in the community are down to just a handful a day. Fewer than 100 patients remain in hospital.
Mr. Lee says this has given the government the confidence to gradually and carefully reopen the economy and society. But like any other country, Singapore hasn't been perfect in its pandemic response.
With hindsight, we would certainly have done some things differently. For example, I wish we had known earlier that people with COVID-19 were infectious even when they were asymptomatic, didn't show any symptoms. Then, when we brought Singaporeans back home from all over the world in March, we would have quarantined all of them earlier. We would also have recommended that everyone wear face masks sooner than we did. We would also have acted more aggressively and sooner on the migrant worker dormitories. All this is wisdom after the fact. We must learn from these errors and do better the next time.
While COVID-19 remains as infectious and potent as it was before, what has changed is that Singapore has built up capabilities to contain its spread. Mr. Lee adds that COVID-19 will not be Singapore's last public health crisis. Even though the authorities have been expecting another new disease to emerge since SARS 17 years ago, he says that COVID-19 is not the worst new disease that can appear, or what scientists dub Disease X, which is highly infectious, deadly, and mutates easily.
But it is only a matter of time before Disease X happens. So we had better learn from COVID-19 how to deal with a pandemic and be as ready as we can should when a worse one befalls us. We should build up our resilience, our instincts, our preparations, so that when Disease X comes one day, we will be prepared.
And even as Singapore continues to manage the immediate situation, it must also look forward and prepare for life beyond the pandemic.